I want to talk a little bit today about our PICC crew philosophy. This is a new standardized method for how we resuscitate patients. Whether you have 6 months of experience or whether you have 26 years of experience in resuscitation, we are standardizing our approach to how we resuscitate every patient so we have more successful outcomes. This is based on science and experience and will benefit from the new provider to the experienced provider. You work a cardiac arrest better than anybody in the medical industry. So we are going to stay and work these resuscitations on site, but we need to set ourselves up to be successful. And that means standardizing our approach on how we resuscitate patients. The days of resuscitating a patient in the corner of a bedroom, doing compressions with one hand, need to stop. We need to set ourselves up to be successful, and if it takes 5 or 10 more seconds to drag that person into a living room or even out into the front lawn, we need room to work and standardize our approach to resuscitation. When you move the patient to have an appropriate resuscitation, standardized positioning of the equipment, as shown in this video, are priority. Your monitor should be placed at the feet of the patient. Your airway bag should be placed at the shoulder, as well as a drug bag placed at the opposite shoulder. Priority number 1 in our resuscitations are good quality compressions. The compressor is the most crucial piece of our puzzle. No one takes priority over the compressor. Each provider should rotate after approximately 200 compressions. Priority 2 is placing defibrillation pads and evaluating for a shockable rhythm. These 2 priorities are by far the most important priorities of any of our resuscitation. Good compressions and defibrillation will contribute to the highest percentage of cardiac arrest saves, and our priority must be of these 2 before all other things. Our rationale of going ABC is not effective in a cardiac arrest. This is not an airway arrest, it is a cardiac arrest, and our focus has to be on good continuous compressions and defibrillation.
100. Not shockable. Get back on CPR. Ready to take over CPR for you. Alright, I'm going to throw down the airway.
Priority number 3 should be placement of a supraglottic airway. Place 10 liters of oxygen to the oxygen port on the iGel. Focus should be on good continuous compressions and evaluation for defibrillation. The patient should not be intubated at this point in the resuscitation unless there is an airway obstruction and is absolutely necessary. If available resources allow you to ventilate the patient, remember not to overventilate the patient. Overventilated patients have poorer outcomes. Remember to only ventilate 6 to 10 times per minute. Remember to charge the monitor prior to discontinuing compressions. This allows less time off the chest. Familiarize yourself with your monitor so you can safely discharge the charge if unneeded.
Luke, I'm going to have you move to the airway, and I'm going to go ahead and do IV and medication.
Priority 4 is IO placement and medications. Remember, IV and IO medications make very little difference in the outcomes of patients. Good compressions and your focus on defibrillation will be the difference of survival in your patient. Remember, the standardization of your scene and paying close attention to these priorities in order will increase the survivability of your patient for better outcomes.